All right, so the recording has officially started for our final COVID-19 Lunch and Learn series. We have Cam here today from Crisis Services. She's going to tell us a little bit more about her organization and her role in Crisis Services. But today's meeting is really all about identifying domestic violence from a provider perspective and how we can best support our patients who might be experiencing domestic violence. So I'm going to give it over to Cam, and if anyone has any questions, please, as always, you can either submit them through the chat, or because there's such a small group of us, maybe when we get a little bit closer to the question part, you can just unmute yourself.
Thank you. Hi, everyone. My name is Cam, and I am the training specialist for the Advocate Program of Crisis Services. I've been with the agency since 2011. I started as a volunteer and then was hired on in 2013. And here I am. I run our volunteer program, and I also do community-based education, training, and outreach. So today we are going to talk a little bit about what Crisis Services does. So as providers, let me just move my screen so I'm not like looking at myself here. So what the Advocate Department does, because as providers in whatever kind of, field or work you're doing, you may be, working with a survivor of domestic or sexual violence. I'm including sexual violence in there because that is such a big part of our lift, and it's really unique to Crisis Services, and what that means for us. And then also, April is Sexual Assault Awareness Month. So I will always, every April, take the opportunity to kind of ring that bell and break down those stigmas around talking about sexual violence. I'm also going to cover how COVID has impacted our work. As you can see, I'm working from home. So in so many ways, it has really impacted our work, and how we've kind of adapted, a little bit over a year in. So a little bit of the language, I like to give a little preamble about the language that I use. When talking about the people that experience these types of crimes, I refer to them as usually a survivor or a client, because they're the person that I'm serving. We tend not to use the word victim. It's not really a positive term. Nobody likes to call themselves a victim of anything, right? And, they've survived something. So survivor is appropriate, but I tend to use the word client because that's who we're serving. The people that commit these crimes, we tend to refer to as perps, perpetrators. What's really nice about my job is I just believe survivors. If somebody tells me something happened to them, I don't need to say alleged or suspected. I'm not a judge. I'm not a jury. I'm not a police officer. I don't need to say alleged or suspected. I can just believe survivors. And that's the basis of our work, believe survivors. And then everything else comes after that. As far as the use of gendered pronouns, when giving examples of work that I do, I may use gendered pronouns, but we try to avoid them as much as possible. But I want everybody to have, that understanding that gender exists on a spectrum. There's a lot of different genders. We, however, know the truth of the matter, or the reality of it is women and women-identified folks tend to experience these crimes at the hands of men or male-identified folks more often than not. But we do know that men experience these crimes, male-identified folks experience these crimes. Trans, non-binary, gender non-conforming folks experience these at a really high rate as well. But there is a lot of cultural stigmatization for those folks to come forward in fear. So we like to talk about it really openly, break down the stigmatization of people talking about what happened to them, no matter what their gender is. Does that make sense?
Absolutely.
But take care. Great, thank you. But take care of yourself. As I said, we're going to be talking really openly about domestic and sexual violence, which can be, a hard topic. Our society doesn't do great at talking about these things. We don't really have good modeling of that from schools and parents and things like that. So talking openly about it can be really different and difficult. I understand that. So take care of yourself, whatever you need to do during the course of this presentation. So this is kind of the meat and potatoes, but it's only one slide. So the Advocate Department, we are the Rape Crisis Center for Erie County. Every county has one designated rape crisis center. we are it for Erie County. So that means a lot of things. But the number one thing that that means is that we respond to all 10 emergency departments in Erie County 24/7, 365 to assist survivors of domestic violence, sexual assault, family violence, and elder abuse. We do this with a team of trained staff and volunteers. So if you're ever interested in volunteering, you can always get a hold of me. We do, anyway, like I said, we do this with a trained, group of trained staff and volunteers. When we're in the hospitals, we do immediate crisis intervention. We do suicide screening. We do emotional support and advocacy with whoever else may be present. After we see somebody in the hospital, we fill out a bunch of paperwork with them. That paperwork then goes back to the agency. The agency, then the crisis services, our supervisors in the advocate department, then assign that client, that person that we saw in the hospital, to a case manager. That case manager then does the longer term work with the client. And this could be things like helping that client find new safe housing, helping that client testify in court, helping that client participate in a lineup, helping the client sign up for social services benefits. Whatever it is, it's all driven by the client. What's important to note too, especially with domestic and sexual violence, is that we will never force our clients to do anything. We all believe in choice and people having the autonomy to choose what they want for their lives. So we will never force somebody to do something. We will never force a domestic violence client to leave his abusive spouse. We will give them all the resources and all their options if that's something that that person is choosing to do, and lay out all their safe options. So if I'm talking to a client in the hospital and he tells me, I want to go back home, where I know his abusive husband is, that's his choice. He's an adult. He gets to make that choice. What I'm going to do, though, is work with him on how best to stay safe while he is at home. So, for example, if things start to get heated again, is there someplace else in the home that you can go that has a locking door so you can keep yourself physically safe? Do you feel comfortable calling 911 with the understanding that not everybody does? Do you feel comfortable calling 911 if this becomes violent? Is there a friend or family member that you could stay with if you need to? I talk with people about packing go bags. So like a little grocery bag or something with a change of clothes, an extra cell phone charger, like $5, already packed up, maybe hiding in the trunk of their car, hiding in a room in the house, hiding in a neighbor's house, hiding in a friend's house, so that if that client that I'm working with needs to get out of their home quickly, they're not sitting there waiting, rummaging through their drawers, looking for all this stuff while their perpetrator is maybe engaging in emotionally, verbally, or physically violent behaviors. Same thing for our sexual assault survivors. Do I want sexual assault and domestic violence perpetrators to go to prison? Absolutely. However, I know that that doesn't mean healing for folks. Healing isn't found in the criminal justice system. It's not built for that. It's built for detention. It's not built to heal victims. It's not. So that doesn't mean justice. A perpetrator going to prison doesn't necessarily mean justice, which we all know. So if I have a client who doesn't want to call the police, she doesn't have to. We can work with whatever else she needs for safety. And that includes safety planning, and that includes things like therapy, help. Maybe she just wants her locks changed. That will help her feel more safe. Whatever it is, it's up to that client to choose. I'm going to cut over to therapy. We provide free therapy for primary and secondary survivors of sexual assault. 100% free. We don't bill insurance, Medicaid, Medicare. We don't take co-pays. None of that. 100% free all the time. And that is, like I said, for primary and secondary survivors. A primary survivor of sexual assault is the person that experienced the crime. A secondary survivor is someone known to them, a loved one, mom, dad, husband, wife, brother, sister, whatever, who is feeling some type of way about what happened to their loved one, and they want to come in and talk about it. They absolutely can, and it's free. And so that might be a good resource, while you're, doing your work as providers, that it's totally free. And that is the only free sexual assault therapy in Erie County. What's interesting is all of our staff are certified by the New York State Department of Health as certified rape and family violence counselors. The only way to get that training, or to get that certification rather, in Erie County is to work at or volunteer for crisis services. So that means that our therapist is the only therapist in Erie County who's a certified rape and family violence counselor. And she's free. So she takes referrals. So please give crisis services a call if you're working with a survivor of sexual violence who could really benefit from therapy, and free therapy at that. We provide campus advocacy for our college-based survivors of domestic violence and sexual assault. We know that sexual assault is at an epidemic level on college campuses. It has been for a while, and we want to end that. So we work on college campuses, but as crisis services, working with survivors. So we can help those survivors with things like getting their dorm changed if they share a floor with their perpetrator, getting a class changed without penalization if their perpetrator is in their class. We can get them excused from a final if they were sexually assaulted 2 days before, and this is just too much to do at that time, with no penalization from their end. Part of federal civil rights law, Title IX, says that sexual assault and domestic violence survivors on a college campus are afforded that, but an advocate needs to complete that kind of groundwork to get that done for a survivor. So we do that. What's super nice is though we work on college campuses, we don't work for the college. So that means two things. That means that we are a confidential resource. So that means a student survivor can come to us and tell us whatever they want, and we don't have to and can't tell anyone. Whereas on a college campus, there's all sorts of laws in place that if a student survivor, tells his professor has to report it up to his supervisor, who then has to report it up and report it out to the federal government to get a snapshot of sexual assaults on college campuses, which is beneficial. But some people just don't want the story of their sexual assault reported up. And I get that. So we are a confidential resource on campus. And then kind of my favorite part about that is because we work on the college campus, but not for the college, we can help hold a school accountable if we feel they are not doing right by that survivor. Like I said, there's federal civil rights law called Title IX that gives clear directions to institutions of learning, so including K through 12, about what they have to do for student survivors. So if they are doing something wrong, we can help that student maybe file a lawsuit with the federal government because their their civil rights are being violated. We have done that in the past. And since we don't work for the college, no skin off my back to help them do that. And like I said, we have done that in the past with local universities, help students hold that college then accountable for their civil rights being violated. I'm giving you so much information, so please let me know if you have any questions. We do prevention and education. That is generally what I do for the program. So I do like this kind of stuff, community outreach, and presentations. So, presenting to you all. I presented at Hilbert College a couple of times yesterday to speak with their counseling students to talk about these kinds of services and how best to help survivors. I've spoken at adoption agencies, and foster care agencies. Maybe your new foster kid experienced child sexual assault. How can you help that foster kid now that they're living in your home? I've spoken with Bills players about domestic violence. They had to start doing that a couple of years ago, get education about domestic violence. I train at the police academy. I train new recruits at the academy on how to conduct sexual assault investigations, primarily focusing on what not to do when speaking with a survivor of sexual violence. That's all great. That's all the education kind of stuff. And then we do prevention for high schools and colleges. It's called bystander intervention. So how you can, if you see something unsafe, how you can intervene in a safe manner so that it doesn't lead to sexual assault. So, sometimes we'll use an example of, say you're at a frat party and there is a young woman and she is asleep on the couch, and somebody comes up, scoops her up, and is carrying her upstairs to her bedroom. What can you do to make that a safer situation for that young person? So a lot of that, we're really trying to work ourselves out of jobs. In that prevention stuff, we're trying to get into more high schools because high schools are supposed to be doing that education based on that federal law. But not all high schools do. High schools and high school administrators get a little bit nervous about talking with young people about consent and things like that. But there are absolutely age-appropriate ways in which we can do that. But if your agency that you're working at, wherever, I know Sam mentioned there were maybe some doulas on this call. If you, for your agency, your program, whatever, would like some training and education about domestic or sexual violence, please let me know. At the end, I'll put my information in the chat and you can always let me know. We'd be happy to do something like that for your agency. I'm still going. We do so much in Advocate. We run for New York State, we run the New York State Domestic and Sexual Violence Hotline. So this number is on the back of domestic violence police reports for every police department in New York State. So officers are supposed to, when they're speaking with a person who's experienced domestic violence, call that hotline with that person who just experienced domestic violence, or at least give the phone number. But we have been doing that for a long time. And, so we hear from people all over the state. We also run the Erie County Domestic Violence Hotline. So we get a lot of, local calls on that. But in addition, that for some reason, I don't know why I don't have here, but we run the Prison Rape Elimination Act hotline. The Prison Rape Elimination Act, we also call it PREA because we love acronyms. PREA was signed into law by George W. Bush in 2003. It was voted on unanimously, which, as we know, does not happen often. But basically what this says is rape isn't part of the sentence when somebody is incarcerated. That no one deserves to be sexually assaulted, and it establishes clear guidelines for what jails and prisons have to do if somebody is sexually assaulted in their facility. It also affords rights to incarcerated survivors, that they get the same access to rape crisis services as community-based survivors do. And so part of that is they can call this hotline. They just hit 777 on any phone in the facility. And they, between the hours of 7 a.m. and 11 p.m., and they can call and speak to a sexual assault counselor about what they experienced, and we can refer them to their local rape crisis center because we get calls from all over the state for inmates. So that's something that we started a couple of years ago. We're really proud of that. And it's definitely really unique. There's only 3 of those, even though the law was signed into, or that law was passed in 2003, there's only 3 of those hotlines throughout the country. So we're really proud that New York State incarcerated survivors get those services. Okay, so I'm going to go and start talking about this. So when we're talking about domestic or intimate partner violence, DVIPV, again, a lot of acronyms, we say that this is rooted in power and control. It's all about one person having control over another, and it can take on a lot of different forms, which can be impacted by a lot of different factors, including the gender of both members of the couple, age of the couple when they began dating, experience of each partner in the relationship, as well as family history of violence for each partner. We know domestic violence is cyclical. If somebody witnesses domestic violence as a kiddo, they're more likely to either be a perpetrator of it or a victim of it later in their own lives. So if we're serious about ending domestic violence, we have to start with children. So I'm going to talk a little bit about that. But we understand that it is cyclical in nature. We do have this kind of process of domestic violence. So we have a honeymoon phase, a tension building phase, and a violent episode phase. I'm going to explain each. So honeymoon phase, can be at the beginning of a relationship when everything is good and wonderful and you love being around your partner and it's really a positive experience. And then we see moving into a tension building phase. That tension building phase is often when things start to get a little bit rough, maybe that perpetrator, that abusive partner is belittling them, putting them down, isolating them from their friends and family. That's where we see the survivor often making excuses for their partner, kind of walking on eggshells, right? You just know something is up. And then we move into our violent episode phase. The violent episode phase is kind of the worst of the worst in the relationship. It doesn't always need to be quote unquote physically violent. It can be emotionally violent, financially violent, whatever, but it's the worst of the worst in the relationship. And then it kind of moves back into that honeymoon phase. And that's where we often see those perpetrators trying to get back into the lives of their partner, apologizing and bringing flowers and candy and gifts and all those types of things. I know it looks really simplistic to break it down in this manner, but I got to be honest with you, seeing so many of these, situations since I've been with crisis services for about 10 years, it does often break down this simply, unfortunately. But it's important to remember that each of these phases can last any amount of time. That honeymoon phase can last 10 years. That tension building phase can last 20 years, right? It doesn't matter. It's all different for everyone else. Okay. Sorry, one of my supervisors just was calling me and texting me, and she knows I'm in this meeting. Let's see. So we have some warning signs for violence in a relationship. What's important to understand is that just because somebody is experiencing these things, or these things are existing, I should say, in a relationship, does not mean it's definitely violent. But these are commonalities that we see in the perpetrators of the clients that we work with. I think some of them that we don't really think about is that first one there, that quick moving courting phase, sweeping you off your feet, right? Where everything is always really, really intense right away. Sometimes people call it love bombing, if you've ever heard that term before, where it's just on 10 from the jump. Like I said, growing up in a home where domestic violence was common, and tolerated, right? If there is a acceptance of violence and that's normalized for a kiddo, they're going to continue that later in life. Family, friends, community, tolerant of violence, somebody who maybe gets into fights, who has an inability to manage stress, hurts animals, drugs or alcohol abuse. Now, something to remember with drug and alcohol abuse is drugs and alcohol do not cause domestic violence. I've worked with plenty of clients of survivors of domestic violence who just say to me, they just need alcohol counseling. It's only when they drink that this happens. And while I understand alcohol certainly can exacerbate situations because it can kind of reduce people's, decision-making skills and encourage them to engage in risky behavior, that it doesn't cause violence. Millions of people get drunk throughout our world every single day, and they don't put their hands on their spouse. There is something different about this person if they're putting their hands on their partner after drinking. Does that make sense? So it doesn't cause it, but it can exacerbate the situation. We see some warning signs is that person needs control. they're possessive. We say jealousy isn't cute. Jealousy is a form of abuse. And then conforming to rigid gender roles. So like I said, these aren't end all be all, but they're just kind of commonalities that we see. Something to keep in mind, if you're working with a survivor of domestic violence, there's a ton of reasons why someone may stay with their domestic violence perpetrator. All of these are different for each survivor, and they're legitimate. I won't call on people, but some of the reasons that people tell us that they stay with their perpetrator is, of course, love, right? Just because something terrible happened doesn't mean your, maybe 10-year long love affair with this person goes away. You sometimes keep in mind the birth of your first child or your wedding day or your first date or whatever. It doesn't go away. There's, of course, fear of the unknown, right? If I leave, what's my life going to be like? Where am I going to live? How am I going to parent these kids by myself? And also fear of the perpetrator. We know that often in domestic violence homicides, it occurs after the victim has already left their perpetrator. I've worked with plenty of clients who tried to come back and kill them after they had left, months after they left. They got a new job, they set up a new apartment, live in a new life, thinking perpetrator is out, and perp comes back and tries to kill them. And people know that. There's been pretty high profile cases of that, and locally. I don't know if you all remember a couple of years ago, Jessica Cameron in Niagara County, who she left her child's father, and then he came to her work and set her on fire in an attempt to kill her, right? It was after she left. She thought she was safe. So it's that kind of fear as well. And then lack of resources. If you have 3 kids and maybe you don't work because your partner has been working this whole time to support you and the children, what does that look like for you now supporting them, for you getting an apartment? The amount of money that DSS provides, Department of Social Services provides for people for housing is pretty low, especially as housing and apartment prices in our county skyrocket. So these are just some of the reasons, but it's different for everyone. We also know domestic violence is a leading cause of this kind of changes every year for pregnant women, but it's one of the leading causes of death for pregnant women. A lot of people think, or I've worked with clients that tell me, once they got pregnant, they thought that the violence would end, but it actually oftentimes increases, because what increases during pregnancy? Stress, worry. Now you're going to be stuck with this person for at least 18 years, right? So we see those kinds of things. Stress about money, stress about where to live, who's going to take care of the kid during the day while so-and-so works. All sorts of things like that can increase stress, increase tensions in a relationship, which can increase violence. Like I said, we work with on-campus survivors of sexual violence as well, sexual and domestic violence. So I've got some information here about, we've only got 20 minutes left, so I'm not going to go through all of this, but we do know that 43% of college women, women identified folks on college campuses experience dating violence. And that can include physical, sexual, controlling behavior, things like that. And then 58% of college students say that they don't know what to do to help someone who's experiencing dating violence or domestic violence. So that's a lot of why we do those training and education things. Sexual assault is any sexual act committed against a person without their consent. This is a blanket term, and we use the term sexual violence interchangeably with sexual assault. So this is the working definition of sexual assault. This actually comes from SUNY. You might remember sexual assault used to be all about no means no. Well, it's all about yes means yes. It's all about a voluntary, verbal, positive affirmation. It's an agreement reached between equal, unimpaired partners without coercion. So consent is all about the presence of positive feedback, not the absence of negative feedback. We're trying to make consent and consensual sex a really positive thing, and that's why this definition has changed over the years. This is the sexual violence pyramid that we created a couple of years ago in crisis services. And really what this does is this kind of illustrates how some of this problematic behavior at the bottom, rape jokes, sexist, homophobic, transphobic comments, an attitude of boys will be boys and victim blaming can lead to all of these other things, right? It's like if you give a mouse a cookie. If you accept these things, it's easier to accept these things. And then it's easier to accept these things. And then it's easier to accept these things, right? So we have to get to the root of the problem of sexual violence, which is this bottom, bottom level of the pyramid here. If we say those things are unacceptable and continue to kind of knock those things down, knock out that bottom section of that pyramid, the rest of the pyramid will topple over. So these things on the bottom are what we see in our society more. We see those things often when we're walking down the street or when we're at a bar and we overhear some comments being made. I remember I was at a Sabres game a couple of years ago, and behind me, I heard some of this problematic kind of quote unquote, locker room talk, boys will be boys talk behind me. And I was with my dad and my brother, and I was like, I have to say something. And my dad and my brother are like, all right, go for it. So I turned around and, I call out this behavior when I see it, because that's the only way we're going to work on dismantling this sexual violence pyramid. Like I said, we know that on-campus sexual violence is at an almost epidemic level. We see it goes between every year, between 5 and 6 American women has experienced attempted or completed rape in her lifetime. And that goes for being on college campuses as well. For college age men, it's actually about 1 in 16. For non-college age men, it's about 1 in 33. Okay. So it's pretty high. I'm not going to go through these myths with you because I want to cover other stuff. But one of the things that I wanted to show you, especially as you're working with folks in the community, is options for survivors in the hospital. When we respond to a hospital for a sexual assault call, we bring with us a forensic nurse. That forensic nurse completes the rape kit evidence collection. Within 96 hours, that nurse can complete a rape kit, including a DFSA kit, and that's a drug-facilitated sexual assault kit, so that we can determine if that person has been drugged for the purpose of sexual assault. Within 120 hours, we can give Plan B one step to prevent our client from getting pregnant from their attacker. We have no restrictions on sexually transmitted infection medication. So if somebody was sexually assaulted 2 days ago, 2 weeks ago, 2 months ago, whatever, they can come in and get this medication to protect them from getting certain STIs. For HIV PEP, which is the prophylaxis after exposure to HIV, that actually just changed. The CDC changed that to 72 hours, but it's still kind of our shortest time frame. So within 72 hours, somebody can come to the hospital and get preventative medication to help protect them from HIV. And then hepatitis B, tetanus shot as needed. And you can imagine with taking all of this medication, pregnancy preventative, sexually transmitted infection preventative, HIV preventative, that's a lot of pills. And actually for the STI, that's a shot as well. And so it can make people a little bit pukey. So we will provide anti-nausea medication as well. What's important to know is I don't expect you to memorize any of these time frames, just that there are time frames and that there are services available for folks. And all of this is free. A survivor will never receive a bill for this. New York State pays for all of this. Okay, so this is what I wanted to show you. So how our work has been impacted by COVID. So like I said, we respond to area hospitals for survivors of domestic and sexual violence. Well, March 17th of last year, we were not allowed in hospitals anymore. Hospitals made the decision that no one but patients only, for the safety of patients, staff, and, those people who would want to come to the hospital. So I put together this little snapshot of of what our calls look like. So blue is domestic violence, orange is sexual assault. So you can see that between March and this, I pulled this for December, between March and December, these were the calls that we got. 233 for domestic violence, orange for sexual assault. Because we weren't allowed in the hospital, we were doing all of our work with survivors over the phone. So it definitely was not great, right? Like building rapport and having somebody tell you about the worst moments of their life isn't really effective over the phone. It's truly not. But we did the best we could with the tools that we had. And you'll see, so this is a really low number for us. And I don't think it's that, I certainly don't think it's that domestic violence was decreasing during the pandemic. We think it's that people were afraid to go to the hospital. We do see, it's pretty close, 2019 and 2020 for sexual assaults. I mean, it's, it's not that far off. It's not as far off as domestic violence, but people were afraid to come to the hospital. We had people calling our hotline that experienced sexual assault or experienced domestic violence, and were like, no, I don't want to go to the hospital. That's where sick people are. I'll get sick if I go to the hospital. And I get that. That was a real fear. So that's understandable. Whereas pre-COVID times, in that same time frame, March to December, we had 529 domestic violence calls and 160 sexual assault calls. Now we are back in all of the hospitals. We are in person again at all the hospitals. However, we're still thinking people might be nervous to go to the hospital, especially with these new variants and things like that. So domestic violence and sexual assaults were heavily impacted by COVID in the sense of survivors getting services. We also saw, survivors are now stuck in the home with their perpetrator, right? They have no ability to call and get help, right? Before pre-COVID, if, the survivor didn't work, perpetrator works. Well, when perpetrator leaves for work at 9 a.m., that's a great opportunity for them to call a hotline and get some help, or for them to flee and get to a shelter, or to get to the hospital. But with that perpetrator now working from home or laid off because of the pandemic or whatever, home with them all the time, they have less ability to seek safety. We also saw some service providers not open or being remote. A lot of our work was remote, so we were trying to still do as best as possible. We're not a walk-in facility at Crisis Services. Our safety and security is pretty top-notch, but some providers across the state are walk-in facilities, and that walk-in ability was shut down for a lot of service providers. Courts weren't really open right at the beginning. All the courts closed. Most of the courts then moved to remote work. But that's a huge barrier too, right? Like if a client, a domestic violence survivor, has a meeting with a district attorney, they're also afforded the right that they get to be present at all court proceedings having to do with their case. That's a right afforded to people in New York State. Well, the district attorney is like, all right, I'll send you the Zoom link. Well, not everybody has access to technology, a laptop, a smartphone, or internet access, Wi-Fi, or anything to be able to view that court and kind of be a party of their own case. So that was a big barrier. And you were able to just walk, prior to COVID, you could just walk into the family court and walk up into the family court and seek an order of protection, and usually be granted on the same day. Well, now you have to call and make an appointment, or it's virtual. So that's a big barrier too. Police response time was increased, we saw, especially things like ambulances. And especially in bigger cities where ambulances and police were responding to sick people with COVID. There was a lot of rumors going around too that police were not responding to any calls unless it was like a murder or shooting or something like that, that there was a lot of rumors that police weren't responding to 911 calls for domestic violence because of COVID. We called area police departments to say, what the hell? We're hearing these rumors. Are these true? And we were told they were not true. But that's a rumor going around that domestic violence survivors heard. So they're less likely to call the police and put themselves out there and let the perpetrator know they called the police if the police aren't even going to respond. And then, of course, kids being in the home more with daycares and schools and things like that shut down. We believe there was an increase in child abuse and child sexual abuse. I work with an agency called the CAC. It's the Child Advocacy Center, and they assist child survivors of domestic and sexual violence. We serve at Crisis Services, we serve people ages 12 and up. The Child Advocacy Center does 12 and below. And their reports for child abuse, neglect, and sexual abuse were really, really decreased in COVID. And that's because children's natural safety nets were gone. Teachers, daycare workers, things like that. Kids often are helped because their teacher, they either disclose to their teacher or their teacher notices marks and bruises and things like that. But without being in front of those helping people, we know that children were less likely to get help during this time. So I wanted to cover volunteering with Crisis Services. I run our volunteer program. What our volunteers do is our volunteers go in person to all the hospitals as well. They complete a 40-hour training that's done by myself and that is overseen by the New York State Department of Health. It's done in the evenings and one weekend day, spread out over the course of like 3 or 4 weeks. We ask volunteers to give 24 hours a month to hospital response. We ask for at least a 6-month commitment, but if somebody gives us a year commitment, then they get a certification from the New York State Department of Health as a certified rape and family violence counselor. And again, the only way to get that in Erie County is to work at or volunteer for Crisis Services. I made a 6-month commitment back in 2011, and here I am running the program. So, so it worked out well for me. I'm going to put my email in the chat too. I'm going to stop sharing, see if we have any questions.
If anybody has any questions, there's so few of us that please unmute yourself. If you don't feel comfortable asking a question, you can always put it in the chat and I will ask the question for you. But thank you so much, Cam, for that extremely informative presentation. I feel like this is a conversation that we, like you said, we typically don't have a lot, particularly at the high school level as well, in terms of just like discussing what a healthy relationship actually looks like. What does domestic violence actually look like? We hear a lot about it, but we may not necessarily know how to identify it. So I'm hoping that if anyone who previously didn't know how to identify domestic violence now has a better understanding of kind of what that looks like. So
yeah, and actually it's funny. Part of my work that I do is for my advocacy work is I meet with senators and assembly people to talk about upcoming legislation. And I just met with Assemblyman Norris this morning, actually, because there is pending legislation in New York State to roll out more robust sex, consent, and healthy relationships education in K through 12 schools. Currently, health education, what they receive is not mandated except for mental health. 2019, New York State mandated that schools have to talk about mental health, suicide, things like that in health classes, but sexual health, it's not mandated what they have to talk about. It's just up to the teacher. And that can include consent and healthy relationships as well. So we're really pushing for, a mandate and guidelines about healthy relationships being taught in schools, consent and sexual health being taught in schools as well, because they can get that stuff in college, but it's almost too late in college. People's ideas about relationships and sex and consent and things like that are already formed by the time they reach college. So we're hoping for that legislation. I have a couple more meetings with senators and assembly people in the next coming weeks, and I'm going to continue talking about that legislation, but keep on the lookout because you might see that coming down from New York State.
That's absolutely huge. I mean, I talked to my sisters. My sisters and I are kind of far apart in age. So one of my sisters is 7 years younger than me. The other one's 10 years younger than me. So we all grew up in the same district for the most part. So I'm always like, well, how did like the education that you got revolving like health? My sister and I took a healthy relationships quiz because she didn't have a boyfriend at the time. So like just kind of the way that she's learning about healthy relationships versus the way that I learned about them, even though we had the same health teacher, just, 7 years apart in terms of how that education has changed, what they've added, what they've kind of taken out. I think it's really important.
It's totally different. I grew up in Hamburg, and one of my best friends, we graduated the same year, but she grew up in Orchard Park. And those high schools, Hamburg and Orchard Park, are literally down the street from each other, just like all the way down the street, like different towns. And so we had different health teachers. And what I got was vastly different than what she got about sexual health, consent, anything like that, because it's just up to the teacher and what their comfortability is. So like 3 high schools in the area have us come in and talk about healthy relationships and consent and things like that. But there's a lot of high schools in the area. So 3
we have a
huge.
very large youth population in Western New York that's only going to get bigger.
Yes, and we're trying to normalize healthy behavior. I'll go into schools and I'll talk about healthy relationships and healthy behavior, especially with things like texting and things like that. And I hear a lot of students tell me like, I have my boyfriend's passcode and I look at all his stuff. I have all his passwords for his social media and I look at all his stuff and messages to make sure this, and this. And I'm like, you are 15 years old. That's not necessary. Like that's not necessary for any age, but you don't need to know where your boyfriend is at all times. You don't need to know who he's talking to. His parents do, but that's it. Like that kind of attitude among young people is really, really normalized right now. And so we're really trying to break that down with like tech safety and respect and things like that.
Absolutely. I'm going to open it up in case anyone has any questions. Absolutely. I don't want to hold over time. Any questions?
So Cameron, I don't have a question, but I am really glad that you came to do this presentation today because we do offer some high school programs and I'd be really interested in having you come and speak to our students if that's something that you are interested in.
Yeah, absolutely. I put my email in the chat, but yeah, feel free to email me anytime. We'd love to do that. We actually have a really cool relationship right now with Narden Academy, which is a private Catholic girls school, and we're doing some really cool stuff with them as far as like social norm campaigns and messaging and things like that. It's really, really cool. So yeah, we'd be happy to come talk to your students.
Great, thanks.
If nobody else has a question, I'm going to ask a question if that's okay.
Sure.
I think one of the things that you talked about in your presentation, and that's kind of like that social pyramid that you talked about, like kind of knocking out that first layer. In what ways can both men and women kind of aid in knocking out that locker room talk and other things like that?
I think a lot of it is calling it out when we see it. When your friends if you're around a group of friends and they're making kind of this transphobic comments or transphobic jokes, for example, homophobic jokes, being like, why is that funny? That's not funny. I work with a state trooper who actually he handles sexual assault investigations for the college campuses in Erie County. And he's like this guy, he's like 6'8", he's like this big dude. His kids play hockey and he's like an advocate. I swear to God, he's like all bought into ending rape culture and ending victim blaming and all of that. And he would be calling out, he tells stories of like calling out the hockey team dads, and they know not to make these jokes, at least around him anymore. He's like, I don't know if they still make them, but they don't make them around me. And that's a start for people to learn. If I can't make this joke around this person, maybe I shouldn't be making it around anybody. It's just kind of calling it out when we see it, whether that's online, whether that's in person, but holding your friends accountable too, I think is huge for men and women, and any gender really, to say, hey, this isn't okay. I like to do this thing of like, if somebody makes one of those kind of jokes, and be like, so explain that joke to me. Because then people really have to explain this horrifying joke, and you can see people's wheels turn in their head as they're explaining it to figure out, oh, wait a minute, this might not be right. That's what I like to do in kind of a tell me more about that. Help me understand why this is a funny joke, and kind of watch them figure out why it's not a funny joke. And And I believe that when we establish with our community and establish with our friend group or whoever that this isn't okay, like that bottom rung isn't okay, then we can begin talking about the top rung or the next rung above that. And we can hopefully dismantle that, because we know domestic violence, rape, and gender-based murders are unacceptable, right? No matter anybody's gender. All of these things are unacceptable. So we're not going to end those types of things until we take out that bottom of the pyramid, and the rest of the pyramid will topple over. It's just up for people to decide. We talk about it like, we don't expect you to be a superhero, but how long is your cape? Where does your cape go to? And mine is the bottom of that pyramid, calling everything out. But for other people, it might be a little bit higher, and that's okay, because we all have a part to play in ending this type of stuff.
I absolutely agree. That was a wonderful response. Thank you. I've noticed that as I've gotten older, like my friends and I will have these conversations about what we learned, whether it was in our sexual health classes or kind of what our parents taught us, and not only cultural differences, but also just like informational differences and biases that we may have.
Yeah.
And kind of calling each other out on like, that's not actually right. Or like, so much has changed within our lifetimes in terms of the information that's accurate and correct and kind of what those sources look like for us. And so sometimes even just having like a small conversation with your friends, I've noticed has kind of created these like, like I didn't think about it like that. Like we should really like talk about this more, not talk about that in that way.
Everyone makes mistakes too. Like even when we're talking about, misgendering someone, like everyone makes mistakes, but when you know better, it's an opportunity to do better, to apologize and do better the next time. And that can go for any of this language. That once you know better, it's kind of on you to do better and keep trying to do better and not make those mistakes again.
Absolutely. Thank you so much. So we only have a minute left. Any last questions before we log off for the day? Anybody? It's okay. These can be short questions.
I have a quick one.
Yes, please.
Are you like a firm believer in like we have strong gut instincts of like telling that something is wrong kind of early on? Or do you think like our gut instincts aren't always like correct? Like, do you think it's better to just believe that when you feel it early on, or should we just kind of ignore that till we get more information, because they could not end up being that way? You get what I'm saying?
Like as far as if somebody is in an unsafe situation, like if you're seeing an unsafe situation?
Yeah, like they're kind of throwing a little bit of flags at you. Like you kind of have a gut feeling a little bit at first. Should you believe that, or kind of continue on to see if they're actually like that? Like, do you believe we have like good, strong gut instincts usually?
Yeah, I think we should trust our gut instincts, because even if in that like situation that I laid out for you, that example, even if you intervene, if you are doing it safely and respectfully, even if you were wrong, no one's getting hurt. But on the flip side, if you don't intervene because you second guess yourself or whatever, somebody could get hurt. So it's really like, what's the worst that could happen if I speak up? What's the worst that could happen if I don't speak up? And it's just kind of weighing those situationally for you. I believe in trusting our gut. There's a book called The Power of Fear, I think it's called. But it talks about how humans' kind of propensity for anxiety has made us so that we're still alive today and we weren't all eaten by dinosaurs, right? That gut instinct that our ancestors have followed has kind of led us to where we are today. And, maybe other species didn't have that same gut instinct, right? So it's all about trusting yourself and being trained and then kind of weighing what's available to you. So it's kind of like threefold, really.
I think that's an excellent place to end for today. Thank you so much for your wonderful presentation, for taking the time out of what I can only assume is a very, very busy and hectic schedule to come talk to us. Like Cam said, she has put all of her information in the chat. Everyone who attended today will get an email with the recording link, and you can share it to anybody who who wasn't able to attend for today. But I'm going to end the call. Thank you so much. If there's any last minute things you want to say, please do.
Well, thank you so much for having me. Please reach out if you have any questions, concerns, or anything like that.
All right, see everybody later. Thank you so much for attending our very last session.
Thank you.